Good evening. I'm George Latimer, Westchester County Executive, and welcome to our COVID-19 Town Hall conversation here on Facebook Live. This is Thursday, January 21st, and I'm very happy to be joined by mayors of our three largest cities in Westchester County who will talk a little bit about the COVID-19 situation in their communities and the work that they're doing in their administration, working alongside of the county and the state government to deal with these issues. And we also have with us Dr. Dial Hewlett, who is one of our chief individuals in the Department of Health, expert in this area of communicable diseases. So Dr. Hewlett, Mayor Bramson, Mayor Spano, Mayor Patterson-Howard, welcome. We're glad to have you all with us tonight.
Glad to be here with you.
Thank you. Thank you all. We're here to take some of your questions, and you can evidence those questions in the comments section of the Facebook page. Our Director of Communications, Catherine Chaffee, is here. She'll take a look at the questions, try to summarize some of them if they're in the same basic area of public policy. We will try to answer as many questions as we can after each of the folks has a chance to say an opening series of comments. Obviously, if you have a very individual question, it's better if we answer that question individually, separately from the general telecast, and use this as an opportunity to deal with the more broad-based questions on COVID-19. Obviously, we're living now into the 11th month of a pandemic and closing in almost in a year duration. And from the very first case that happened in the city of New Rochelle, Mayor Bramson and I were involved that very first week together, to the impacts in Yonkers and in Mount Vernon and all across the county, we've had to deal in a different climate, both the climate of how our normal responsibilities in government are changed because of the COVID pandemic, the way we live our normal lives, the economies of our county and our communities have been dramatically changed. Businesses that have been unable to stay open or viable because of the economic impacts of COVID. We're dealing in a situation where cities and counties don't have the primary authority or responsibility to act, but yet we have a responsibility to communicate with our neighbors and our residents. So it's an interesting set of problems that have been laid at the desk of the mayors of our three major cities. So I'd like to at least turn to them first and have them share some of their experiences. And I'll start with Mayor Sean Patterson-Howard from the city of Mount Vernon. You began your mayoral career, Madam Mayor, and within 2 months, we had a pandemic on your doorstep. So tell us how you've weathered it in Mount Vernon.
Well, even though I'm not asthmatic, after I got my asthma pump because I needed to catch my breath, we have a really good team. And we set up an incident command system. We reorganized government into 4 areas, which was public safety, human and community services and outreach, economics, and infrastructure. And that's how we really just operated through the pandemic. We had police, fire, and Office of Emergency Management, along with creating a quality of life task force, really go out and do a lot of work around COVID compliance, and even the reopening of businesses under the COVID environment. We came together very, very quickly as a new leadership team and developed partnerships and innovations to help push us through this crisis. So it's been an adventure. Like you said, within 60 days, COVID was upon us, and before 75 days in office, we were under a state of emergency. So it's been an interesting ride, but I think we've pivoted and been able to make a lot of adjustments and work closely with not only within government, with our community and our faith partners, our partners around the county and different municipalities, to develop the best plan of action possible to address the very, very difficult challenge of COVID.
Well, it's certainly been a baptism by fire, and we're coming through the fire and to get to the other side and some advancement. As the largest city in the county, Yonkers represents a unique managerial challenge that really none of the rest of us face, even those of us who run the county government. There's 200,000 people in a very urban setting, and you have the range from poverty to wealth in Yonkers. You have a beautiful river on your western side, and Mike Spano, who I served with in the county legislature, I served with in the state legislature, but Mike and I got into the deep end of the pool now, him running the city of Yonkers and me having this responsibility in Westchester County. Mike's been mayor for a decade. but nothing told us that we were going to get a pandemic, did it, Mike?
No one told us about the pandemic. I probably don't know if I would have run for the third term had someone told me, but I will tell you this: the holiday surge is upon us, and we said that we knew that that holiday surge was going to bring in additional numbers, and so the numbers are, especially in Yonkers, are hovering around 250 new cases a day. That's a pretty sizable increase, and as the county executive put it out there so perfectly is, Yonkers is a city of 18 square miles, over 200,000 people. Most of the people that live in Yonkers live on the west side. We have a tremendous number of people who live in struggling communities who are seeing a real influx, a real rise in the number of people who are getting COVID-19. But the good news is, people don't appear as sick as they did last year, though it feels like COVID is all around us right now. I feel like at least our healthcare facilities can manage it. Our hospitals, we have two hospitals in Yonkers, but one that's on the outskirts of our city that serves the people of Yonkers, and they are stressed, but not overrun like they were last year. So we know that the vaccines are coming, and that's the federal government, and I'm hopeful that with the President Biden that we'll see them come a little quicker, because we need them, and we certainly need them in our cities. I need to have a vaccine that's distributed right in the heart of Yonkers and the 10705, 10703 zip codes where the people are experiencing the most and suffering the most from the pandemic. But thanks to the county executive, certainly to the mayors that I serve with here in Westchester, thanks for being on this program, because this is important, and this is how people are getting information these days. So I want to make sure that I'm a part of it.
Well, it's been a terrific partnership with Yonkers, with Mount Vernon, New Rochelle, and the other cities, Peekskill and White Plains, which has not always been the case. The county hasn't always been ready to, put shoulder to shoulder and try to figure out how to work through some of these things together. But when this all began, it began with a phone call that I got from the mayor of New Rochelle, Noam Bramson, who was at the epicenter of the beginning of this. And within the day, we were together talking about some strategies. He took leadership right off the bat. We were in touch with the governor, and it was shocking, because we were hearing about the pandemic, across the globe, and then we'd heard about some fatalities in Washington State, and the next thing we know, we had 100 cases in New Rochelle. But through all of this, Mayor Bramson, Noam Bramson, has shown leadership, and I've been happy to work side by side with him. Noam, what's the latest in the Queen City of the Sound in New Rochelle?
Well, first of all, George, I want to return the compliment. From those early days, it's really been so reassuring to be able to work with you and your team. We have felt very well supported and very well guided, and that's been critical from beginning of this crisis to where we are now, and presumably will remain critical as we look ahead to the light at the end of the tunnel. So I would echo Mike's comments in terms of where we are now. You can look at it like many things as the glass half full or the glass half empty. The bad news is that our COVID numbers are really spiking. 932 active cases in New Rochelle as of today, almost where we were at the peak back in the spring. And so it is, of course, dispiriting to find numbers that are so high. We all worked so hard to knock down the COVID incident rate through the spring and summer and early fall months. And now we're back in a difficult circumstance. It's not unusual in terms of Yonkers and New Rochelle or Mount Vernon. Our figures really track with our population, and this reflects a regional trend. But it is obviously concerning, and we all still know friends and neighbors who are succumbing to this illness, and that's the most tragic aspect of it of all. The good news, as we heard a moment ago, is that the vaccine is here. It's safe, it's effective. There's every reason to hope that as 2021 progresses, more people will be vaccinated. We will come closer to approaching herd immunity. And there's reason to be hopeful that we'll get back to something resembling normal life. We all recognize that the vaccine rollout has been challenging, that supplies are still constrained, nowhere close to the demand. Many people seeking the vaccine have found the process to be frustrating, so it does require a great deal of patience and persistence. But I do think, especially with an administration in Washington that has shows every sign of being committed to a competent national COVID strategy, there's reason to expect that supplies will ramp up. And just as the testing process back in the spring started out a little bit chaotic and eventually matured into a more efficient, predictable system, I think we'll see that with vaccination as well. So I choose to be optimistic about our course. And in the meantime, all of us really need to continue being responsible, keeping our distance, wearing masks. All the things we're tired of doing after all these months will remain critical until we really get to the end of the tunnel.
Well, Noam, I think you've laid out, what is something we all talk about, that we see a light at the end of the tunnel, but we're still in the tunnel. And in fact, January has turned out to be exactly what Dr. Fauci predicted back in October when he said January would be the most difficult month. And I'm not sure I necessarily believed it. I have great faith in his, his advice, but I wasn't sure because what I saw was what you alluded to was the diminution of the virus throughout the course of May, June, July, August, September, and into October. And we felt like, well, I guess we've got this thing in a good place. And then in the last 3 months, it has not been in a good place, and certainly spiked by Thanksgiving, Christmas, and New Year's. But Dr. Hewlett, your experience comes from a professional standpoint. You look at those of us in public office, and we try to deal with the general population and the general realities of things. But from a scientific standpoint, what can you tell us about, viruses in general, and this one in specific, that would help us understand where we are in the natural flow of things and where we might be going in the next month or two ahead?
Yes, well, thank you, Mr. Latimer, and thank you on behalf of Commissioner Amler for having us as part of this forum. With regard to this virus, and some of you probably heard Dr. Fauci earlier today, like any other RNA virus, it is mutating. And with some of the mutations that have been reported, one mutation or mutant strain that was reported from the UK and another that was reported from South Africa, they have been shown to be much more transmissible. So it's easier for the virus to be transmitted from one person to the other. That means that more people are going to likely get the infection. The good news, as Dr. Fauci shared, is that masks and facial coverings still will work in preventing these infections from occurring. Also, the other thing that was mentioned was that the vaccines will still be effective against these variant strains. The other thing that's very important to know is that although these are mutations, it does not appear that these new strains are more likely to cause more severe disease or more likely to cause fatalities. But I think in the coming days, we have to be concerned because we know that these strains are here in Westchester County. We know that people are infected with these strains. And so as Mayor Bramson mentioned already, it's very important for people to continue to be vigilant, for people to continue to use the face coverings, to continue with distancing and also with avoidance of gatherings until we get to that 70 to 80% range as far as herd immunity is concerned. The other thing which I think we want to say is, and that's the light at the end of the tunnel, Mr. Latimer, that you talk about, is that we do have the vaccine. We are actively vaccinating at 134 Court Street. It is by appointment. Today, I was told that the line was all the way around the corner to the East Post Road. So there is really a great demand. One of the things that we are concerned about, and it's something I think that's up for further discussion and was alluded to earlier, is that we are hoping to see more individuals come for the vaccine who are from the areas that have been greatestly impacted. So we haven't seen as many citizens from Yonkers and New Rochelle and Mount Vernon, and we're talking right now about how we might be able to develop other sites which will make it easier for people to come in for the vaccinations. And also, there's a lot of discussion about how we can make the registration process a lot more user friendly, especially for some of our older citizens who may not have access to computers, as well as for some of our citizens who are in under-resourced communities.
Well, thank you, Dr. Hewlett. I'm going to just give a little bit of groundwork on a couple of issues before we open it up, and then questions can be directed to individual members of the panel, or anyone can jump in to try to answer a question. We've dealt in this COVID vaccine outbreak with what seems to be sort of three basic streams right now. One stream is what is the infection, the set of numbers, and how are we doing? Number two is how are we continuing the testing module, which allow us to maintain some degree of our economic activity, given in the case of at least two of these communities and some other ones, yellow zone status from the state. And then, of course, the distribution of the vaccines, which has become the most immediate discussion issue across the board. Looking at the numbers that came out from the state today, 11,500 active cases, which is the net result of how many people have tested year to date positive, pandemic to date positive, less the number of people from 2 weeks ago. We're showing that we're approaching 600 individuals that are hospitalized for this disease. Now, that's about half of where we were at the peak back in the spring, but it's a significant number of people. It's still fairly well below the hospital capacity of Westchester County. So we're not on the cusp of what you've seen on television in Southern California, Arizona, rural North Dakota, where the number of sick people have eclipsed the amount of rooms and availability to help them. So hospitalizations at that number. Fatalities have risen now to over 1,800 fatalities. And we've had now 5, 9, and 11 and 13 people a night that are being affected by this. And that's a concern to us because when we were going through the summertime, we had very little in the way of fatalities. We had weeks where we had no one fatally affected. So the advancement of the virus right now is running a fast race, and it's the distribution of the vaccines that will be the offset to that. As we know, just for baseline discussions, the system of vaccination distribution has been set up in our area by the state of New York. They've set the rules for who's eligible to be vaccinated, and they've set up the places to vaccinate, and they are responsible for delivering the product that they receive from the federal government. The federal government has not, during the prior administration, established a national vaccination program. They let each of the 50 states do their own thing. When you live in Westchester County, adjacent to Connecticut, next door to New Jersey, and with relatives in Florida and California and every place else on the globe, we have constant comparisons between why is this happening in Connecticut and not in New York? How come they can do this in New Jersey and they're not doing it in Westchester? And the very simple answer is there was not a national program to this. So Governor Murphy, Governor Lamont, Governor Wolf in Pennsylvania, and everybody else, along with Governor Cuomo, are constructing programs that are state specific. And in that, just as it was during the testing period where all the data goes to the state, just as it is in the designation of the original containment zone in New Rochelle, or later on these yellow and orange zones, all of these decisions are coming out of the governor's use of executive authority in concert with the state health department and other health advisories from the CDC and so forth. So what it falls to the county government to do and the local governments to do is to implement plans that the state puts into force to try to do everything we can to vaccinate, to test, and so forth. And pretty clearly, we're just in the front end stage of the vaccination process with the places that we have. I think the point was made a second ago by Dr. Hewlett, and my mayoral friends will agree. We have to have a significant, robust vaccination presence in Mount Vernon. We have to have a significant, robust vaccination process in Yonkers, and we have to have the same in New Rochelle. And I would add in Peekskill and Mount Kisco, and most likely Portchester, so we cover the extremities of the counties and make it as easy as possible for people to come and get the vaccine. I'll tell a quick anecdote that leads back to growing up in Mayor Patterson Howard's city. I grew up on South 14th Avenue on the south side, and our medical doctor was at a building on Stevens Avenue, just across the street from City Hall. Years later, as an adult, across the street, I wound up working at 100 Stevens, but the medical building that I went to was 105 Stevens. My mother had no car, could not drive. Dad had the car, and he took it to work every day. So my mother would trump my sister and myself from South 14th Avenue up over Scottsbridge and down Stevens Avenue to get whatever vaccination shots we got in the doctor's office at 105 Stevens Avenue. And that was as near and accessible to me as those would be as a child. There was no way on earth that she could have brought us up to Westchester County Center to do this. So we know that if we're going to fight this disease properly, we can't fight it as a county. We have to fight it in concert with every community and reach out to every one of these neighborhoods and these various demographic groups of people in order to do the best job that we can. And if we don't get the vaccine out there in enough arms, if there isn't enough product at the top, then this race that we're having against infection will win. But if we get enough vaccinations out there and we get to that point, and I'll let the doctor determine whether it herd immunity or universal immunity, whatever it is, less people get the disease if they're protected by the vaccine, and we pull ourselves out of this. So with that as a connective piece as to where we are today, I want to go to the questions. Catherine Chaffee is going to identify a question. And Catherine, if you would direct it to one of our panel members, myself or any of the others, and give folks a chance to answer directly.
Absolutely. Well, the first question that we've gotten quite a bit over the past few weeks, and this, I think, Dr. Hewlett, you'd be the best person to answer this, is how do we know that the vaccine is safe?
Okay, thank you, Catherine. I think we know that the vaccine is safe in a number of ways. The vaccines were both subjected to very rigorous clinical trials, and there were over 30 to 40,000 people who were enrolled in those trials. And during that period of time that those trials were going on, there were very few what we call serious adverse reactions or side effects from the vaccine. The most common thing I think that was described was an allergic reaction. And in the people that had those allergic reactions, all of them recovered. We have had a very good experience here in Westchester County to bring it to a local level. Out of the first 2,000 people that we have administered the vaccine to, we have seen really, I think, only a couple of people who had very minor reactions so far. And so we think that the vaccine is very safe. I think that the FDA reviewed the data very, very carefully, as well as the other group, the American Committee on Immunization Practices, which is a group of individuals who are not with the manufacturers, but they are independent academic people, and they essentially felt that these vaccines were safe. Those of us who are in the medical community, myself included, we have actually rolled up our sleeves and we have taken the vaccines. And I have urged everyone in my family and all of my relatives and all of my friends and anyone who asks for my advice that they should roll up their sleeve and that they should take the vaccine as well. So I'm convinced that it is safe. And I participated, in fact, in a task force that was put together by the National Medical Association. And we heard presentations not only from the two manufacturers who have been approved already, Moderna and Pfizer, but we also have heard presentations from the vaccine manufacturers who are putting vaccine out for the future. And all of the products seem to be, are going to be safe, and they all are going to be effective.
Thank you, Dr. Hewlett. And we need to hear that because those of us as laymen don't necessarily know what's in the vaccine. And we also have a certain amount of doubt because we don't know, and we have to rely on some professional input. Catherine, another question?
Yes, the next question is for Mayor Spano of Yonkers. We've gotten a question similar to this for all the jurisdictions in the county, but specifically for you. With Yonkers being such a large city with so many COVID-19 cases, why doesn't Yonkers have a main vaccine hub, and how can we get one in the city?
That's really important. If you think about it, our cases just over the last week or so have grown by active cases have grown by 1,200, and that's a significant number, and that's something that has us afraid. But at the same time, like I said before, everyone, the managed care facilities, our hospitals, everyone is doing what they ought to be doing. So, but considering that Yonkers is in a yellow zone, that there is a tremendous population that's kind of crammed into a few square miles, and that many of the people, the families, just won't travel to White Plains. It's important for us to get a facility here in Yonkers, and I've asked, I've sent a letter, obviously, to the governor and to the administration, asking that they make something available. We will work with the county. Obviously, we'll work with the state. We have facilities. We have old hospitals. We have an old, the PAL, it's an old armory. We have facilities that can offer, that are right dead set in the community, that can offer the vaccine to any family that is willing to walk in our doors. They could walk right to the facility. It's right in the heart of the yellow coated areas. And so we're here, we're ready, we're willing. A lot of it, I think, has to do with supply. So we're hopeful that that the supplies are coming, and then we'll able to get something up and started.
And I just want to say before we go to the next question that Mayor Spano, Mayor Patterson Howard, and Mayor Bramson have all been very aggressive about reaching out to us to get our assistance and support to identify a place in their locations that makes sense for them. We saw that in the testing setting when we started to have urban testing locations, Mount Vernon Neighborhood Health Center down on 4th Street, when we were able to put it into locations in Yonkers and in New Rochelle. We got a better response in testing when we put it closer to where people live. And the great, combination of population is in that southern tier from Yonkers across to Mount Vernon, New Rochelle. Catherine, next question.
Next question is for Mayor Sean Patterson Howard. What role has Montefiore Mount Vernon played in the rollout of the vaccine and testing in Mount Vernon?
We can't hear Mayor Patterson.
Mayor, your audio is muted.
Oh, I'm sorry. Okay. So Montefiore initially was a site for a point of distribution for the state for the vaccine, but they have since lost their status as a vaccination site due to several breaks in New York State protocol. I believe New Rochelle experienced the same thing with their Montefiore location. So, in the beginning, as everyone has stated, it was very difficult for anyone to get tests. And we experienced that until we were able to get a testing site up at the neighborhood health center. And now it's very difficult to get vaccinations. The rollout of testing and now the rollout of vaccinations are definitely far behind, but that's because we have not had a national strategy and plan. We're confident that with new leadership that this is going to become more of a priority. But as Mayor Spano stated, in the past few weeks, we've seen our active cases double. We were hovering, in the 300s to 400s, and as of today, we are at 814 active cases. So the only thing that is going to stop this train from going off the rails is vaccinations being made available. We have asked Montefiore from the beginning of this virus to be more of a partner with us. They did some minimal ramping up of beds, but as we know, Montefiore has been talking about closing that location since October of 2019. They continue to transfer out services. They do not have an ICU in Mount Vernon, and so they have not been the best partner in the response to COVID-19, whether it came to testing, vaccinations, or providing care in an ICU. So it's been a challenge. The good thing on the horizon is that the county has always been a very good partner with us. We've been able to also get support from our other major cities, even in the beginning with sourcing PPEs and things of that nature. And right now we are all in the same battle of trying to get vaccinations. We don't want to compete with each other as a city. We need to have a coordinated plan to bring vaccinations into our region. We have spoken with Reverend Richardson, Dr. W. Franklin Richardson of Grace Baptist Church. He sits on the governor's COVID equity vaccination group, as well as the executive director of the Neighborhood Health Center, who oversees the health center here in Mount Vernon and Yonkers. And we do expect to have those two locations be points of distribution for the vaccine. And we are hoping that we can even push for a drive-through site here. We all need vaccines desperately, like we said, to slow down the progression of this, and also to prevent from dealing with all of the mutations that are happening right now. And I know that we are all advocating. And I think that we will get farther together than competing against one another, but all of us want to make sure that our individual communities and our region are fully vaccinated for those who want to take the vaccine.
Well said, Madam Mayor. Thank you. We have a question for Mayor Bramson next.
We do. Mayor Bramson, the question for you is about communication, which we all know is incredibly important during this time. How is New Rochelle communicating with its residents?
Well, we try to flood the zone using every tool at our disposal. The broadest form of communication is robocalls, mass messages that we use whenever we feel that there's a topic of sufficient urgency or time sensitivity. And we've had to use that system more frequently over the past year than in any time that I can recall previously. That's been very important, but we don't just do that. We also use our social media channels. We use lawn signs to display messages that require sort of perpetual reminder. And we utilize community partners to help spread the word. And that's vital because as much as we might like to think that we in government are universally trusted, the reality is that there are many people who are skeptical about messages that come out of the government and are more inclined to trust what they hear from a not-for-profit agency or from a house of worship or from neighbors and friends. And so being able to tap into those partnerships has been essential for us. And it's particularly relevant to a crisis like this, where so much of the solution comes down to individual responsibility. And so very often communicating the facts and encouraging people to take responsible action themselves is the most powerful and consequential thing that local government can do. So we've taken that responsibility seriously. And if I could just come back to the prior question that Mike and Sean addressed, I think it's important to recognize that when we advocate for vaccination sites in our cities, we're not being parochial about it. There are good merit-based reasons why it's necessary to site these facilities in communities like ours. You have a higher density of the virus, as was indicated. You have more people with limited transportation options who may not be able to make it to regional hubs. And we've all seen the painful evidence that the virus preys more aggressively on communities of color, which are located disproportionately in cities like ours. So lots of good reasons why physical access to vaccinations will be critically important, along with additional supply, along with the procedural access that the doctor mentioned, making it easier for people to sign up. And finally, overcoming the vaccine hesitancy that may in the long run be the biggest obstacle we encounter to herd immunity. And that too, by the way, is an issue that is disproportionately concentrated in some of the most challenged subsets of our community and will require extra attention on all of our parts.
Thanks very much, Noam. Why don't we continue with the questions from the audience so that we try to cover as much ground as we can between now and 7 o'clock.
So the next question, I think, Dr. Hewlett, is in your wheelhouse. We've heard quite a few times from Sarah Siegel on Facebook, who has a child in kindergarten. And we hear a lot from parents. Some want the schools open, some want the schools closed. Sarah in particular asks, is it safe for a school to be open for 100% in-person learning when the spread of the virus is high in that community?
My response to that is that, of course, this may be a bit controversial, but what we have actually found, and I believe that some of the data actually comes from Yonkers, that the rates of infection among the children in the school system is actually lower than the rates in the community. And we believe, and the data seems to show, that children are getting the infections not from attending school, but they're actually getting the infections from other people who are in their household. In many of our underserved communities, as you know, the children are in multi-generational households. They're living in multi-family units where it is very difficult to quarantine and isolate. And quite often, the school actually is forming a shelter for them. And so the work that we've been doing at the health department, we have been trying our best to work with the superintendents and with the other school officials to try to keep the schools open. We have been working with them to try to limit the spread whenever possible, but we have been really encouraging in-person learning whenever it is possible. Obviously, we don't want to endanger the teachers or other staff, but the data so far seems to indicate that the children in Westchester are safer in the school buildings than they are outside.
You know, it's interesting too that the decision tree for certain things really shift. The state has made most of the decisions on testing and on vaccine distribution, but they've left the decision of keeping schools open to the individual school districts. And while they have the three paths of all in, all out, which would be remote and hybrid, the state hasn't put their thumb on the scale yet to say we prefer this or we prefer that. And at a time when they're making very detailed decisions in a host of other areas. Catherine, another question.
We're getting a lot of questions about how a community is designated a yellow zone or an orange zone, and whose decision that falls to.
Well, I'll tackle that one as a sort of an overview question. Governor Cuomo announced on the advice of his advisors about 6 weeks ago, roughly maybe 7, that he was going to set up a metric system to determine when there would be greater reduction of interaction in the community on the basis of the level of infection. That was the original standard that was set. And he set up a color-coded system, yellow being the least restrictive, orange being the intermediate level, and red being the most restrictive. And that when infection rates reached a certain point, and we were tracking infection rates at the state level by every municipality by zip code, they would determine that certain things would have to shut down or be modified in order to try to contain the advancement of the disease. So at the point in time, it wasn't the first week that he had these zones in, but the second week he came in and he designated the village of Portchester with a little bit of overlap into Rye Brook and the city of Rye. But basically the village of Portchester has a yellow zone, and that began the process of the county having group phone calls with key decision makers in the community, providing more PPE and hand sanitizing equipment to try to make sure that people who live in the community interact when they're outside of their homes would be able to do that safely. Within the week or two, he upgraded the orange zone capacity to Portchester, which is more restrictive than yellow zone. It does things like reduce the percentage of people that should be in a house of worship. It bans indoor dining, but allows for outdoor dining, and he just modified those provisions recently in light of a court case. And it also was telling things to school districts about what they could and couldn't do. Given these three choices, they would narrow scope them down and actually under orange zone capacity close the schools. A couple of weeks into the process, after identifying, the 5 zones in Westchester, 6 zones actually, they then changed the metric from infection to hospitalization availability. And so depending on the fact that you don't really count the hospital as being just available in the one community, it's part of a network of 11 hospitals, whether they're formally linked or they just happen to be in the same geography. And it became the metrics of infection percentage that drove the decision on schools. And in the last few weeks, he's made no across the board decision on schools. He has left the closing of the opening to the districts. But if you are going to stay open in an orange zone capacity, you have to test 10% of your school population. That means staff and students. And you have to do that every 15 days. So you do the first cohort and then the next cohort, the next 15 days, with the idea that you'll be able to better isolate those who are infected from the rest of the group and therefore not spread the virus if this was done properly. And it's a massive task once a zone has been named orange, yellow, or red, because you really don't have, if you do this, you get out of that consideration. So I know right here, both Mike and Noam have yellow zoned areas. They may want to comment on that. But, what do you do to show improvement to get out of yellow zones so you don't have that same restriction? Because elsewhere in the county, you have basic restrictions. All restaurants close at 10 o'clock. And, there's a necessity to have plans in every business for plexiglass and so forth. But uniquely in yellow and orange zones, there's a further set of restrictions. So I don't know if either Mayor Spano or Mayor Bramson want to comment on the yellow zone realities that they've had to deal with.
No, you
Sure.
know what?
I mean, you go ahead first, Mike.
Oh, sure. I real quick. I mean, just to go back to overall. I mean, Yonkers is the 4th largest school district in the state of New York. We have about 27,000 kids in the school district, and we're doing the hybrid. Some of our kids are coming to school, some of our kids are not. We have really insisted on keeping the talent, the teachers in the schools so that they're able to teach our children either in person or remotely. And that has been going along as smoothly as I think anyone can expect. And we have done all the testing. We've done all the testing that's been required of us, especially in the yellow zones. And what we're seeing very, very clearly is that the number of either staff or teachers, staff or students that are COVID positive is significantly lower than what we're seeing on the outskirts. And so the school is a safe place for your kids to be, and certainly we're making it that way. So that's and that includes yellow zones. The numbers are significantly less. Dr. Hewlett was 100% right when he was talking about that.
No.
I just wanted to add that I think that the cluster typology made a lot of sense when it was introduced. It was kind of a whack-a-mole approach. If you have a generally stable, semi-acceptable condition throughout the region, but you're seeing spikes in certain highly localized areas, well, you want to get a handle on those spikes and try to keep the virus from spreading further. I do think we're kind of past that point now, unfortunately. Kind of all the moles have popped, and the conditions which existed previously just in the yellow and orange clusters are now pretty generalized all across the Hudson Valley and all across New York. And so even though the clusters are technically still in place, my sense is that they're no longer the focus of state policymaking, and that the state's priorities have shifted to kind of a broader approach that deals with challenges we all share in common.
I think that's right, Noam. Pretty clearly, the dialogue with the state has been almost always about vaccine distribution. And when the metric shifted from percentage of infection to hospitalization here in Westchester County, the 11 hospitals of Westchester, and you might want to include a couple of the Connecticut hospitals that serve as local hospitals, Danbury, Greenwich, for some of the neighboring Westchester areas, we were not stressed in hospital availability, and therefore the rationale when you shift to hospital availability did not, require us to upgrade zones. In some ways, we have all advocated for the elimination of the zone concept and just deal with, whatever the infection level is with extra activity to the extent that extra activity can solve it. And probably the most important extra activity is the distribution of vaccines. That's the fastest way to reduce the infection. We're still working with about 10 or 12 minutes left. So let's go back to questions.
Absolutely. So the next question is for Mayor Sean Patterson Howard. What steps are you taking to educate and secure vaccinations for people who have distrust in vaccines? So
over the past 3 weeks, I have co-hosted educational forums, especially for communities of color and those who are impoverished, who have a traditional distrust of our medical care system. So in conjunction with the Westchester Black Women's Political Caucus, we held our first forum back in December to have this conversation. We had two incredible doctors on, and they talked about the mistrust, the distrust. They talked about the efficacy of the medication, of the vaccination. They talked about the issues around the Tuskegee study, and even why were we the last communities, why were Black and brown and poor communities the last communities to get access to testing, but yet the first ones to get access to the vaccination, or it being pushed so greatly. That information helped a lot of people. They were able to ask the questions that they wanted. They also wanted to know, why did we trust a vaccine that was produced so quickly when vaccines usually take years? And then we had a second one, which I hosted here on my Sundays with Sean show. And we brought in 3 doctors and a family nurse practitioner, an ER doctor, a public health doctor, and a a doctorate of nurse practitioner, that really spoke about, again, some of those same issues. And those are conversations that we have to have over and over again. Oftentimes I hear people say, oh, these people are anti-vax. It's not that they're anti-vax, but when you have been marginalized and when we have been experimented on, and people can say, oh, that happened decades ago. No, people still have those issues that oftentimes don't feel heard by their doctors now, as evidenced by Beyonce and Serena Williams, who talked about their doctors not listening to them when it came to pregnancy. Oftentimes they feel unheard by the medical community. So there is distrust. And we are having those very public conversations. This isn't, we're talking about structural racism. These are things that make people have a hard time and feel hesitant about getting the vaccination. So we have to have these conversations very openly. We have to have them often, and we have to continue to share the information because, as we know, it is communities of color that have been disproportionately impacted. And if we cannot find a way to help those who are distrustful of the system and distrustful of the vaccine get to a place where they feel they have enough information to make a decision to take the vaccine, we're going to have a very difficult time reaching that 70, 80% vaccination level. And if we don't get vaccinated in our communities and we continue to run high infection rates, it's going to continue to affect our health. It's going to continue to affect our economy. So we just have to continue to have the conversation, and that we will continue to do. And it has to be more than something ceremonial by having a Black entertainer or a Black elected official or a Black pastor or faith-based leader or community leader take the vaccine and show that on TV. People don't want, what do you call them, mascots. They want information. They want their questions to be answered. They want their voices to be heard. So it's nice to show very publicly people who are respected taking the vaccination. But I think the conversation has to be deeper. And that's something that we will continue to do until we answer questions and increase trust amongst those who are least likely to accept the vaccine.
Well, I think, and what the mayor points out rightfully, is that we're not mandating people to do things. We have to persuade them. We have to give them reasons that overcome, whatever their objections might be. If we're going to get people to do this, there's a large demand that wants the vaccine right now. That's what's flooding the system. But at some point in time, there'll be a significant percentage of people who won't want the vaccine, and that's when we're going to have to be sure that the way we've operated all throughout has been to persuade and to give good reasons for people to overcome, whatever their natural objections are. Catherine?
And so
a lot of questions from people who have received the first dose of the vaccine and are now concerned that they're not going to be able to get the second because of the vaccine shortages and appointments being canceled. What can you tell these residents?
Well, I think that we're dealing with a capacity issue from the federal government to the state, and you've seen the governor speak out about needing more of that. And we think the new administration is going to be more sensitive to trying to accomplish that mission. We work on the basic belief that everybody who has gotten the first shot will get the second shot. Somebody asked me, how do I know it? Well, how do I know the sun's going to come up tomorrow morning? I have confidence that things that have worked a certain way will continue to work that way. We understand that if you've gotten the first shot, you need the second shot in order to fully activate the first shot. You lose efficacy if you just have one shot. That's not sufficient to give you the protection that we need to have. And as was said by Mike Spano earlier, we need to have that protection so people can go back out comfortably in the community and re-engage the economy. So I'm going to work on the belief that between the industry, the new president, and the governor, they are going to make sure that wherever we've administered a first shot, there'll be a second shot to follow. Time will tell whether that's a vain expectation or not, but certainly that's going to be our advocacy across the board for all people. Why don't we go to the next question, try to do a rapid lightning round here.
This is for Dr. Hewlett. Sal on Facebook wants to know, will the vaccine be effective against the next strain of coronavirus?
Yes, as far as we know, the vaccine is going to be effective against the strains that are out there, and also probably very likely against the strains that are coming along. Most of the coronaviruses have the one thing in common, the spike protein. And we've actually heard presentations from the chief medical officer of Moderna, and they actually said they're looking at this and they're doing testing to make sure that the vaccine will be effective, at least in the test that they do.
Hewlett, can I be a carrier of the virus even if I get the vaccine?
Yes, that's what we think based on the information we currently have. Now, studies are underway at this very time to try to see if people who have had the vaccine are still carriers. And we are hoping that the vaccine will actually eradicate carriage. But until we actually have the answer to that question, those of us that have been vaccinated still should be observing the usual precautions in terms of the face masks and other things until we actually have the answer to that. But I hope that we'll have the answer to that very soon.
This question can apply to all the mayors. Maybe we go round robin. What have you done in your community to keep the infection rate as low as you can?
We'll start with Mayor Spano.
Okay, good. And if you don't mind, I just, and I'll answer that, but I want to just one thing about something that, Mayor Sean said, and she's 100% right, that distrust about this vaccine, but I would say that it's deeper than just in the communities of color. It is straight across the board. I mean, I recently, our fire department, Yonkers, has 420 or so firefighters, and all were allowed to go out and get the vaccine. And from what I understand, only 100 of them took the vaccine. That's 25%. So there is an education that we have to collectively throw ourselves in to make sure that people are aware that this vaccine is safe and safe for them to use, because there is still a very large segment of our population that is afraid of this vaccine. It doesn't think it's that for some reason they don't think it's safe, and that's why I'm going to do my part. When I'm eligible, I will make sure that I get the vaccine, which is probably the one simple thing that we can do as a leader. Certainly, we're going to have to do a lot more than that to educate people, but and I'm not sure exactly what that is. And I'm interested in the conversation between all of us, especially the mayors and the county executive in Westchester, to figure out a way that we can educate our constituents that this vaccine is safe and it's effective, and it will get herd immunity if we all participate.
Mayor Bramson, your thoughts on this?
Yeah, if you don't mind, I'm going to actually follow up on that same topic, because I think we sort of already covered the different actions we're taking to try to encourage responsible action. I got to say first how much I admire what Sean said about the actions that she's taken and about the approach that she's adopted to having reasonable, honest, blunt conversation with communities that, let's face it, have good reason not to trust. I mean, for those of us who fall into categories like myself, whose trust has never been abused, it's easy to say, well, okay, the experts are right. But if you have a history, and it is historical fact that people of color have been treated differently in the public health system, just as in so many other systems, then that mistrust can be well-founded, and it can only be overcome through that kind of honest discussion from trusted sources of information. And I also have to say, apropos of Mike's comments, we've had precisely the same experience in our workforce. It was shocking to me. And this is a different source of mistrust. It's not that historical experience of explicit and implicit bias, but rather, I think, a kind of generalized and growing distrust of expertise in our society, which is problematic not just in terms of fighting a pandemic, but problematic on multiple levels. And I honestly don't know what the answer is, except maximum transparency, maximum flow of information. All of us who are in a position to set an example, to set that example through our personal conduct, and hope that eventually truth wins out over false rumor or self-defeating skepticism. Because it would be a cruel irony if, having been through this terrible year and having lost so many loved ones, through our own hesitancy, we deprived ourselves of the real solution and needlessly lost more lives.
Well, Mr. Mayor, that's probably as good a place to bring our conversation to a close. We've been joined by Mayor Noam Bramson from New Rochelle, Mayor Sean Patterson Howard from Mount Vernon, Mayor Mike Spano from Yonkers, and Dr. Darrell Hewlett, one of the senior leaders of our Department of Health, to discuss the issues of COVID-19, both in general and in our communities. And I just want to thank each of you for being here today. Thank you, Dr. Hewlett, for your professionalism here in Westchester County, what that means to us. We respect Dr. Amler, yourself, and your fellow medical professionals, both the doctors and the nurses, and the great work that you do within the Department of Health. And to my colleagues in government, we are generalists trying to deal in an environment where science and medicine interact with human beings and the way they feel. And there's nothing that any of us have learned on the streets of our respective communities that give us an exact step-by-step procedure of what to do here. So we have to do it as we go along. We do it together. We do it out of mutual respect, and hopefully we'll all get through this, and we'll be able to see a brighter day. Well, we're not on Zoom together. We're sitting around a table having a meal and enjoying each other's company and sharing some notes about where we go forward. I'm George Latimer, County Executive. Let me thank the mayors again for participating, and Dr. Hewlett. You're welcome to communicate with us continually through communications@westchestergov.com. We will be back with another one of these forums. We're going to bring in some of the other colleagues that weren't here tonight, Mayor of White Plains, Mayor Peekskill, and have a chance to continue this dialogue. And I think you can count on each of these three mayors and Dr. Hewlett and all of us to do everything we can to try to bring us through this crisis as best as we can. Thank you very much for watching. Have a very good evening and stay safe.